Welcome to the Call to Flourish podcast, sponsored by Divine Mercy University. My name is Thomas Cronquist. I'm your guest host with Father Charles Sikorsky, the president of Divine Mercy University. Father, we have a very interesting topic today. We're going to be speaking again with Dr. Ben Keys, who, as you know, is our program director for our Center for Trauma and Resiliency Studies. He's going to be talking about trauma treatment for natural disasters. Looking forward to this talk. Father, how are you doing today?
So I'm really looking forward to our conversation with Dr. Keys. They're always very fascinating and very enlightening, very helpful to many practical things that we run into contact with in our lives.
Dr. Keys, welcome. And we're looking forward to learning about trauma treatment for natural disasters. Can you tell us a little bit about that?
Good morning, Tom. I'm doing quite well. I'm very happy to be here today.
I guess we could talk about a lot of things. What are we talking about here?
It's a wide open field when you ask it that way. What we're talking about is really being there for people in an emotional and supportive way during times of disaster. And there are sort of different waves, if you will, or segments of a disaster where initially, of course, we want to stabilize things and we want people to be able to focus on what they need to do. In the second wave, we would focus on getting people calmed down and really focus on making sure that they're getting what they need for their families, what they need for themselves. But stress reduction becomes very important during that time. And following that, of course, resolving some of the issues of, what do I do now and how do I function and how does my family keep going? So we see a lot of depression, we see a lot of anxiety, and Green Cross goes in teams to work in very specific areas. For instance, during Katrina, we sent multiple teams into different parts of the city and would just check on people and see how they were doing and talk through whatever their experience was with them. Our ultimate goal, of course, was helping them process what has happened to them so that they don't develop post-traumatic stress disorder.
Sounds like there's a lot of different ways this can happen. It could be a hurricane, it could be an earthquake, could be a war. And would COVID be something you would consider a natural disaster? Or how do you define it? Like for purposes of what we're going to be talking about and where the research and everything else is.
It would be considered a pandemic, and as a pandemic would be considered a disaster. Certainly, it's been a worldwide problem and a worldwide issue. Most of our country is starting to come out of the period of time where we were sort of hunkered down and not going out and not going to places. We seem to be coming back to work and school and those kinds of things. But there are still lots of questions, and everybody is a little bit shy. Is it safe? Is it not safe? Do I need a mask? Do I not need a mask? All kinds of issues to that. And you're absolutely correct in saying that there's all kinds of types of disasters, both man-made and natural. Pandemics like this are man-made, unfortunately, and that's where the increased emotion is connected. Typically, man-made disasters comes with a whole lot more anger. Whether it's a terrorist act or it's a pandemic like we're in, there's a whole lot more anger attached when somebody actually does something towards someone else. And whereas the response time and the recovery time with natural disasters tends to be much faster emotionally when it is a natural disaster.
What are some healthy coping strategies for the trauma someone might experience as a result of a natural disaster?
First of all, when we teach this, we teach people to really have a good balance in their life of doing things with other people, of emotionally balancing their physical health, their emotional health, their spiritual health, drinking enough water to hydrate, and staying to their life patterns. In other words, if they read books on a regular basis, use that even now in a disaster to calm down and to relax. If they listen to music, if they're used to writing in a journal, if they're used to doing any kind of art or movement or dance, we want people to return to that as quickly as possible, because we want their life to mirror normalcy as much as possible when they're surviving through a disaster or through some type of trauma.
Not everyone reacts the same way, right? Some people do actually develop trauma to the point where they're traumatized to the point of like PTSD after something like this, while others seem to be more resilient. Could you walk us through like how that, like why were some people seem to be more susceptible to the same experience or a very similar experience? Yeah.
Actually, that is a wonderful question. First of all, in most disasters, approximately 85% of the population will not have any mental health reaction or severity at all. They seem to just pull up their bootstraps and keep going. It's that 15% that we worry about. And and there are percentages in that. How we respond to disaster, what our resiliency is very much determined by childhood and infancy. It's determined by how well we bonded with our parent, usually parent, but our caregiver in those first few months of life. Has everything to do with how quickly we rebound, how quickly our response rate is back. The trait is not something that we can really change, but the resiliency as an action, we can learn to do things that actually improve our bouncing back, or improve our way to return to normalcy and not have to be stuck in being depressed or anxious, that we learn ways of walking our ways out of that. And the skills are largely around things like relaxation skills. We learn how to calm ourselves down. We learn how to keep our stress at lower levels. We learned what are the things that relax us. So that's where we tap into what are our natural inclinations. Listening to music or writing or some type of artwork. Those things can do amazing things to calm us down, to keep us focused, and to allow ourselves the time to be able to bounce back.
Thinking about the pandemic, you mentioned the pandemic. It seems that the inability to return to what is normal, to normalcy, is in itself a source of stress and trauma. You sense people now talking about COVID fatigue, just tired of the pandemic, wanting to get back to normal, and that being a source of real stress for them. Can you see that in other natural disasters where there's just a longing to get back to normal, but you can't do it, and then that's something that has to be dealt with?
It's not that we can't do it. We can approximate it. We can do things that are similar to. We may not be able to bounce all the way back and function as if nothing's ever happened. I always saw that as a little bit abnormal anyway, that you would think that you go back to a place where it didn't happen at all, or you feel like it didn't happen at all. I don't know that we ever do that. It's something that we've experienced, and we have to find ways of integrating and adapting that into our lives. So it becomes important with the skills to learn how to come back. And again, if maybe I'm somebody who does a lot of exercise, and because I couldn't get to the gym, it slowed that process down. Well, I can exercise at home. I can go for walks. I can do things that approximate it. And for a while anyway, that needs to suffice until I can go back to the full level of what I was doing previously. But even that, I'm still going to know what I've experienced. I'm still going to react to what I've done and how I've reacted to things. And one of the survivor questions in any disaster is, what happens if this happens again to me? How am I going to deal with it? What am I going to do if something like this happens again? And for most of us, the answer to that question is, I do the same thing. I cope as best as I can, and I react in ways that protect myself and my family, and wait for things to change.
So, what are some of the signs that a loved one or someone close to us might be experiencing trauma? Talk a little bit about the pandemic, but it could be anything. It could be is it something that manifests itself right away? Does it take time?
Actually, with adults, you'll find that we have a tendency to withdraw, isolate ourselves. We become very hyper alert to what's around us, and we react to things that startle us, things that get us to be reactive. Our mood starts to be on or off depending on how we're feeling that day. And over time, that gets to be sort of agitated and off kilter, if you will. And what happens is I start developing what's called compassion fatigue. I start developing the symptoms that are very similar to PTSD, but it's about the stress of having to deal with my family and having to deal with my spouse and my coworkers and all the pressure that brings in times of an emergency. Along with, of course, everything else that you're dealing with. You're still dealing with paying your bills and, making sure that groceries are brought into the house, and all the things that we do on a normal basis just adds to that stress and tension. So the more I can do to lower my stress level and to de-stress, if you will, the better off I'm going to be. The easier I'm going to be emotionally in working with my family and working with those around me. The easier I'm going to be with whatever it is that I need to jump through to go back to work. Whatever it is that brings me back or brings my family back to normalcy, I need to be able to do it from a place of calm and from a place of being focused.
Seems to me that faith can play a big role in dealing with the stress of a trauma. Have you seen that in your work?
I'm actually glad you brought that up, because statistically and through research, we found that having faith can go a long way to restoring us back to normalcy. Can go a long way to lowering the tension in the first place, knowing that things are in God's hands. And that's not a way of just passing it off, but it's a way of acknowledging that there are certain things that I don't have control over. What I do have control over is how I take care of myself, how I take care of my family, and how I react.
So we talked a little bit about, the context of COVID, which we're all familiar with. We've all lived through that and those challenges. And maybe it's more subtle than something like a war, right? We have a war happens, and there's a lot of if we're not in the middle of it, well, we talk about the geopolitical consequences. We talk about, What's it going to do to, how's it affect me? How's it affect our country? These kinds of, what gas prices or whatever are going to have, we have all those kinds of questions out there. But I guess for the person whose town or village or city got invaded, it's a lot more abrupt and sudden. And, it's not even like COVID would kind of little by little, it sort of worked on people. What would you say, what are the big differences there? And do we have a different approach when we look at, because you can't just go take a walk around the neighborhood or go work out at your home. Well, my home just got blown up. Like, what do you do in that situation?
Interesting that you brought that up. And certainly in the current news, we're hearing about Ukraine and Russia invading Ukraine. I've done a lot of work with the Syrians and folks in Lebanon during that conflict, and that's their day. I mean, bombs coming through the bedroom at 8 o'clock at night, or blowing up outside in the living room or on the porch, and it's living on pins and needles, and especially for those that don't have the wherewithal to get out. They have no place to go. And even if they did have a place to go, it's too dangerous to be in the streets. I know in Syria, they often develop telephone networks to be able to call each other as to what streets to avoid when there were snipers on that street. So that it was safe to get to the grocery, or it was safe to buy a gallon of gasoline. And so they would relay that to each other. And of course, as that happened, they might shift snipers to the other streets. And it was just a whole day of phone calls as to where it was safe and where it was not. I think it's a matter of really working to keep yourself calm and focused, and particularly focused on the things that you need to get accomplished. What does your family need? And that's usually water, that's groceries, it's blankets if it's cold, it's being able to navigate what's happening in the moment becomes very, very important. And that's true really of any natural disaster. How do I maintain safety with my family, particularly while the event is going on? And then in the aftermath, how do I deal with what I need to do to rebuild? Well, what do I need to do to keep food on the table and my family from being in places that are not safe?
Can long-term stress due to the trauma from a natural disaster lead to more serious psychiatric conditions? How do you deal with that?
We try to get people to talk and tell their story. We found that just describing what happened to them begins to allow the person to sort of process what's gone on with them. And telling their story actually begins to lower the likelihood that they would develop something like PTSD. It's not the only thing, of course. It's also, coping and really taking care of some of the things that I just talked about. But just simply telling your story goes a long way. And when we go out with volunteers who are field workers, that's literally what we do. We engage people to tell their story about what happened to them. And if it takes an hour or two, that's fine. If it takes 10 minutes, that's also fine. We work with people pretty much at their own pace and at their own rate. There's no one way of doing this. But showing up and being there for folks is an amazing and wonderful thing to do for another fellow human being in times of trouble.
Being there for folks, so important. The presence, right? And God's presence is always there as well, but we need to be there as well. I was watching recently, it was a sort of a documentary interviews of several American soldiers who were prisoners of war in Vietnam. And horrifying story, they were higher ups who got capped, like their plane was shot down or whatever. And it was interesting. They're very different people, some white, some black, some different ranks and so forth. What interested me, and I know you run the trauma center, but it's also trauma and resiliency. And what was fascinating about this was, now they were different faiths, but they were all men of deep faith. And they said, hey, they had to put their hopes in God ultimately, but they also, on a human level, see, there's tremendous resilience that we have, just even little things. And one of the things that caught my attention, they were in these solitary confinement cells, but there were like little cracks in the door where light would come in at different parts of the day, and it gave them great hope. And they cling to that, right? One of the soldiers was talking about that. And so, just first of all, just commenting on like our natural resilience. And God forbid that anyone listening to this podcast ever is put in that situation, but life happens. Who knows what's going to happen? But just sort of gratitude for the little things was one of the things that you could really see, just to be alive, and then of course love of God, but also love of family. I got to get back to see my wife and kids, and so. Are those good coping strategies, or what would you say about that to help us? I'd say we have a capacity for resilience, but sometimes it's hard.
I think for most of us, we try to find anything that we can hold on to. I'm reminded of the sexual trauma survivor who has a hard time coping with life and holds on to suicidality as a way of living. And what they tell themselves is, if it gets to a point that I can no longer take it, I can always take myself out. And in that is actually hope, that anything that comes in the way, and if they have any kind of spiritual base, they usually get through that because their faith in a power greater than themselves carries them through. And we've certainly seen that with Alcoholics Anonymous and all of the anonymous groups. But the concept of God being in a place where that is beyond where I am is much more powerful than I am alone. And that in itself is often a key that helps people to get through. After the event, their faith and their spiritual life is greatly enhanced.
Dr. Keyes, you mentioned PTSD, and you hear that referred to a lot. And can you explain just briefly what that is, what the symptoms are, and if somebody's suffering from that? It seems like many people are, for one reason or another. What do you do, or where do you go to get help?
First of all, someone who has experienced a very serious trauma. And what we mean is life-threatening trauma, something that threatens your wholeness or your personal integrity. And the symptoms are some of the ones that I talked about earlier. We react to things that remind us of the trauma. So we react to triggers. We begin to have either flashbacks or what we call memory intrusion that is either symbolic of the trauma or represents the very nature of the trauma. So things like flashbacks, nightmares, bad dreams, what we call memory intrusion, where you have thoughts and pictures that you just can't shake. So reaction to triggers, you've got the intrusion, your mood is destabilized. it's agitated, it's off. We react to things around us, so we're hyper alert to everything around us, waiting for the next shoe to fall, constantly searching for safety. And we might begin to start isolating ourselves and keeping ourselves from interacting with other people. Those are all the symptoms of PTSD. And we find that with people that have survived trauma, but we've also found the same thing in first responders, police officers, firefighters, EMTs, who have experienced these things as part of their job. So they develop these symptoms, and left unchecked, it will lead to burnout in their profession and lead to full-blown post-traumatic stress.
And if somebody's experiencing PTSD, that sounds like that can be a very serious situation. Where can they go to get help?
Well, any counselor who has been trained in trauma, one of the things that I'm actually very happy to see is that almost all treatment licensable degrees for mental health counseling, for marriage and family, for social work, for psychologists, all now have to have a component of trauma. They have to have some sort of components in their teaching structure so that they're aware of trauma. And many have gone on to specialize and to learn at a deeper level. All of these mental health professions are appropriate, including psychiatry. But there really is no medicine for PTSD. There are medications for some of the symptoms of PTSD, like the anxiety or the depression, but not for post-traumatic stress itself. So any clinician who has had trauma training, and quite honestly, the church, ministers, priests that have an understanding of people and people in times of need and disaster are often the very front line of where people go to get help.
So how much hope is there for someone who is suffering from PTSD? It seems like kind of a bleak forecast. And obviously if it goes unchecked and you're not trying to get help, then you're, just going to get worse. But if we have maybe ourselves or someone we love, experiencing this, what should prevent us from moving into despair with that kind of a problem?
Many people do move into despair. I would really encourage those people and their family members to please get them to somebody that they can talk to, a counselor that has an awareness of trauma and trauma background of techniques and skills. Because that's the good news is that people that get help get well. This used to be a long-term disability type of thing from the armed forces. It's not anymore. We have a much better handle on how to treat this, and it's a much shorter period of time in the recovery process. But folks have to get past the stigma. They have to get past any kind of resistance to asking for help, to going to counseling. And that sometimes is the hardest step for people to take, is to admit to themselves that they can't do this by themselves. They're going to need somebody to help them get there.
We could do a whole separate show on the stigma, but that's yeah. While you're on the subject, what because this is a question that burns my heart so many times. How to get people over that hump of like, hey, don't be ashamed. You just need some help. How to are there strategies that help with that?
The strategies have more to do with not shaming them or blaming them. It often has to do with childhood things that they've picked up from parents or their peers, where there's a stigma around the need for counseling. They see it as you must be crazy if you're going to counseling. And the majority of counseling is done with very sane, competent people that are struggling with an issue or struggling with a problem. And it's a way of helping themselves get past that issue, get past that problem, and to learn coping skills in the future that they can do it on their own afterwards if they've learned the skills to help themselves out.
I've learned, Dr. Keyes, that many people seeking professional help, mental health, counseling, therapy, want to talk about their faith in that context, but many therapists, counselors, psychologists don't feel comfortable doing that. I know our here at Divine Mercy University, we see that as very important to incorporate a person's faith, the spiritual dimension of the human person, in therapy. Can you talk just briefly about the importance of counselors being able to discuss that with patients when they want to talk about that?
Actually, there's been some research on that, and we have found that when folks are able to incorporate spirituality into their mental health issues, that they actually rebound faster. That it helps them get clarity, and it helps them to get focus. This whole thing started, it's sort of an age-old issue between Carl Jung and Sigmund Freud, where they both had an argument about this that actually ended their friendship. And Carl, for all his issues, personal issues, was the first one to really say that spirituality needed to be part and parcel of the counseling process, because it was so infused into who people are. Whereas Sigmund Freud believed that it was a crutch, that if we're dealing with spirituality, that it was a crutch and that we should just disavow it. And that argument has continued down through psychology and counseling, even unto today. But the research is starting to turn on the side of support for spirituality, support for a good religious base and significant spiritual connection.
So, Dr. Keyes, you are the director here at DMU of our Center for Trauma and Resiliency Studies, and you have trainings for different topics. You do a summer mission related to trauma. What do you offer in this regard for natural disasters?
Father Charles, I'm glad you asked the question. Anyone can participate with us here at the Center for Trauma and Resiliency Studies. We have been hybrid for a while, which means that not only our students, but the community is invited to participate with us. We have trainings, actually 2 one-day trainings on compassion fatigue, where we look at how we take care of ourselves and how we can work with and take care of others. We have a 2-day training in disaster trauma, where folks will learn how to intervene with people during times of crisis and trauma. The different sections of a crisis and how to respond in each one of those sections. They learn about the incident command system, and they learn how to both emotionally and spiritually have a presence with someone that is hurting or having great difficulty. So those are open to really anybody who is interested. And then beyond that, of course, we have clinical training for anybody that's either a student or a clinician of any ranking, if you will, that look at working with families, working with children, dealing with domestic violence, dealing with sexual trauma, of dealing with things that we encounter pretty much anytime we deploy. And then in the summer, we have the opportunity to actually have an experience in trauma where we immerse in a culture for about 2.5 weeks and actually work with them. We work with the clinicians of that country. We work in the situation of what's going on. For instance, last year, we were in Mexico, where we worked with survivors of what was going on with the cartels and problems in Central and South America. These people have immigrated to the wall down at Tijuana, and they're in shelters. They're in tent cities. They're dealing with the drug issues in Mexico and in the other countries and fleeing, trying to get into the United States. And we spent 2.5 weeks working in the shelters, working in the tent cities, and just being there, listening to their stories, and hopefully making a difference in not developing PTSD. In fact, you joined us for a while, and it was great to have you with us.
Well, yeah, that was a great experience. And so you don't need to be a clinician, right? You could be a minister, you could be clergy, you could be someone, a lay person who works in a church or other kind of ministry who could benefit from this training. And
absolutely,
as you mentioned before, it's not just clinicians. We all need to learn more about this, and we all can help people who are suffering from this. And so I think you can check out our website, divinemercy.edu, and there would be, and then look for the Trauma Center. You can get that information.
I really want to point out that particularly first responders, police officers, firefighters, nurses, these are the folks that we really want to take, particularly the compassion fatigue and the disaster courses. But there are other things that they might be interested in, working with children, dealing with grief and loss. Those things are pretty universal.
Outstanding.
Dr. Keys, this is a very interesting topic, but we're running out of time here. And I was wondering if somebody has a question that they would like to ask you, is there a way that they could contact you, send an email, try to get more information?
Absolutely. I'm right here at Divine Mercy, so it's BKEYES, Bkeys, at divinemercy.edu.
Fantastic. Well, Dr. Keys, thank you again for this very interesting talk, and we look forward to other discussions on other topics. I'm sure there will be many more in the future. So again, thank you so much for your time, and look forward to talking with you again soon.
Thank you, and thank you, Father Charles.
Thank you. Great conversation.